Hi everyone, welcome back to Damal Consult Career Academy, your trusted guide to career success. Are you preparing for a registered nurse interview in New Zealand? Whether you're a local candidate or an international nurse planning to relocate, this video is packed with real interview questions and sample answers that will help you stand out and land the job. From clinical scenarios to behavioral questions, we've got you covered, with expert tips and responses tailored for the 2025 ARN interview process. So, grab a pen, take notes, and let's help you pass your ARN interview with confidence. 1. Can you tell us about your nursing background and experience? I'm a registered nurse with over 5 years of clinical experience, and I completed my Bachelor of Nursing degree at the University of Auckland here in New Zealand. My training there gave me a strong foundation in evidence-based practice, cultural competence, and the principles of Te Tiriti o Watangi in healthcare delivery. I began my nursing career in a medical surgical ward, where I gained experience managing patients with diverse medical conditions, handling post-operative care, and performing complex wound care and medication administration. From there, I transitioned into aged care and community nursing, which allowed me to develop skills in chronic disease management, palliative care, and working collaboratively with WNO and multidisciplinary teams. Currently, I work as a senior staff nurse in a residential aged care facility, where I lead a team of caregivers, oversee care planning, and ensure high standards of care and documentation. I'm passionate about providing compassionate, culturally safe care, and continuously seek opportunities to grow and contribute to positive health outcomes for all patients. I'm now looking forward to the next step in my nursing journey, continuing to serve within New Zealand's healthcare system while expanding my expertise and making a meaningful impact. 2. How do you ensure patient safety and uphold nursing standards in your care? As a registered nurse, patient safety is always my top priority. I ensure safety by strictly following standard protocols, infection control guidelines, and the New Zealand Nursing Council's Code of Conduct. For example, I always perform the 5 rights of medication administration to patient: right drug, right dose, right time, and right route to prevent errors. I also double-check any high-risk medications with the second nurse, as per policy. I maintain open communication with patients, families, and the healthcare team to identify any concerns early and act on them promptly. I always document care accurately and in real time, which helps ensure continuity and quality of care. Additionally, I regularly attend training sessions and stay updated with the latest clinical guidelines and evidence-based practices. This way, I not only protect my patients, but also contribute to a culture of safety and excellence. 3. Describe a time you dealt with a difficult patient or family member. How did you handle it? In my previous role as a nurse, I was assigned to care for a patient who had recently undergone surgery. The patient was in significant pain, which led to feelings of frustration. Additionally, their family was very anxious and at times, overly demanding. This situation created tension in the room, making it difficult to focus on the patient's care. My responsibility was to ensure the patient received adequate pain management and to calm both the patient and their family, while ensuring that the treatment plan was followed appropriately. To handle this, I first acknowledged the patient's pain and reassured them that we would manage it. I explained the treatment options available and provided comfort measures, such as adjusting their position to alleviate discomfort. I then spoke to the family privately, listened to their concerns, and addressed each one. I also set clear expectations on how we would manage the patient's recovery and how we would communicate regularly with them. By the end of my shift, the patient's pain was better managed, and their anxiety reduced significantly. The family appreciated the clear communication and felt more at ease. The patient was more cooperative with the care plan, and the environment became much calmer, allowing me to focus on delivering the best care possible. Before we proceed further in this video, If you're preparing for your New Zealand registered nurse interview, you cannot afford to miss this. We've created a complete, easy-to-follow ebook titled New Zealand Registered Nurse Interview Questions and Answers. Inside, you'll find the most common interview questions, sample answers, tips on how to structure your responses. This ebook is designed specifically for internationally trained nurses like you who want to successfully secure a registered nurse position in New Zealand. The best part? Right now, you can get it at a huge 50% discount. It's incredibly affordable and packed with practical, real-world guidance that you can start using immediately. To grab your copy, simply click on the sealer link or the fourth wall link in the description box below this video. You'll be able to download it instantly and start preparing like a pro. Need assistance? Our online customer care team is ready to help. Chat with us on WhatsApp at 2,348,101,066,191 or send an email to damalconsult08@gmail.com. We're committed to helping you succeed. Don't delay, your dream job is waiting for you. Download the ebook today and take the first step toward your future as a registered nurse in New Zealand. 4. How do you prioritize your tasks during a busy shift? During a busy shift, prioritizing tasks is essential to providing safe, effective, and compassionate care. I start by assessing my patient's needs and focusing on the most critical ones. I always ensure patient safety first by checking for any urgent medical concerns, such as changes in vital signs or acute pain. If I identify any critical conditions, I address them immediately by notifying the doctor or taking the necessary action. Next, I prioritize tasks that are both urgent and important, such as administering medications on time, assisting with patient mobilization, or providing personal care to those who cannot do so themselves. I also rely on my team to help with less urgent tasks, such as routine checks or assisting patients with mobility. This delegation helps me focus on more critical care needs while ensuring everything is taken care of. To make the best use of time, I'd group similar tasks together. For example, I might handle all my patient documentation at once during a quieter moment or batch routine tasks like checking vitals. Communication is key throughout the shift, so I keep in touch with my colleagues, ensuring we're all aligned on priorities and patient needs. This helps me stay organized and focused, making sure I can handle the workload efficiently and provide the best care possible. 5. What would you do if you noticed a colleague making a medication error? In my previous role as a registered nurse, I was working on a busy ward with multiple patients under my care. One day, I noticed a colleague administering the wrong dosage of medication to a patient. My responsibility in this situation was to ensure patient safety, identify the error quickly, and address it appropriately, following hospital policies and maintaining a professional and supportive environment. Immediately, I approached my colleague calmly and discreetly to inform them of the potential medication error. I made sure to focus on patient safety and reassure my colleague that we were there to support each other as a team. I then checked the patient's records to verify the prescribed medication and dosage. Afterward, I reported the error to our charge nurse and followed the hospital's procedure for error reporting and corrective action, ensuring the patient's well-being was closely monitored. As a result, the patient received the correct dosage promptly, and the situation was documented properly. My colleague appreciated the timely intervention, and we both participated in a follow-up meeting with the clinical team to review the error prevention protocols. The error was also used as a learning experience during a team debrief to prevent similar incidents in the future. 6. Can you give an example of a time you worked effectively as part of a multidisciplinary team? In my previous role at Auckland General Hospital, we had a patient who was recovering from major surgery and required continuous monitoring for potential complications, including wound infection and respiratory issues. The patient had multiple conditions, so they needed care from various healthcare professionals. including doctors, physiotherapists, dietitians, and nurses. My responsibility as a registered nurse was to manage the patient's postoperative care, monitor their vital signs, administer medication, and provide support to other team members. I needed to ensure that I communicated effectively with the other team members, especially the physiotherapist for mobility exercises and the dietitian for nutritional support. I proactively coordinated daily rounds with the multidisciplinary team, ensuring we all stayed aligned on the patient's progress and treatment plan. For example, when I noticed the patient was having difficulty with mobility, I immediately consulted with the physiotherapist to adjust the rehabilitation plan. I also communicated the patient's condition to the dietitian, which led to a modification in their meal plan to enhance recovery. Throughout the process, I ensured that all team members were updated on any changes in the patient's condition, which kept everyone involved in the care process. As a result of our collaborative efforts, the patient made significant progress in their recovery. They were discharged earlier than expected, and the teamwork helped minimize potential complications. My ability to coordinate and communicate effectively with the multidisciplinary team ensured that the patient received well-rounded, comprehensive care into a positive outcome. 7. How do you maintain accurate patient records and documentation? Maintaining accurate patient records is critical in ensuring high-quality care and patient safety. I follow a few key steps to ensure the documentation is always accurate and up to date. Firstly, I make sure to document in real time whenever possible, noting down key information such as vital signs, medications administered, and patient interactions as they happen. This reduces the risk of forgetting important details. I always follow the hospital's or clinic's protocols for documentation. This includes using standardized terminology and clear, concise language that avoids any ambiguity. If I'm entering information electronically, I ensure that I'm familiar with the electronic health record EHR system and double-check that all data is inputted correctly before submitting it. Additionally, I always ensure that my documentation is factual, objective, and free from personal opinions. If I'm unsure about something, I will consult with colleagues or my supervisor to clarify before making an entry. Finally, I am proactive about reviewing patient records regularly to track progress and ensure that nothing is overlooked. For instance, during shift handovers, I make sure to carefully go over the patient's condition and any changes in care, so that the next shift is fully informed and no critical details are missed. By following these steps, I can be confident that the records are accurate and contribute to the best possible patient care. 8. Tell us about a clinical situation where you had to make a quick decision. What was the outcome? In my previous role as a registered nurse, I encountered a situation where I had to make a quick decision to ensure patient safety. One evening, a patient who was recovering from surgery suddenly started showing signs of distress, rapid breathing, low oxygen saturation, and confusion. I immediately recognized the possibility of respiratory distress or an acute complication. I quickly assessed the patient's condition, checked the oxygen levels, and called for immediate assistance from the medical team. I administered supplemental oxygen while I waited for the doctor and respiratory therapist to arrive. In the meantime, I also made sure the patient remained calm and communicated the situation clearly to their family. The outcome was positive. The doctor confirmed that the patient had developed a mild complication post-surgery, but due to our quick intervention, they were stabilized without further issues. I followed up on the patient's condition and ensured that they received continuous monitoring throughout the night. This situation highlighted the importance of being alert, staying calm under pressure, and making swift decisions to prevent potential complications. 9. What steps do you take to stay current with New Zealand nursing regulations and best practices? As a registered nurse, I understand the importance of staying up to date with current nursing regulations and best practices to provide safe and effective care. To ensure I'm always informed, I take several steps. Continuing professional development (CPD). I regularly participate in CPD activities such as workshops, online courses, and seminars that are specific to New Zealand's healthcare system. This helps me learn about new guidelines, evidence-based practices, and technological advancements in nursing. Nursing Council of New Zealand (NCN's) resources. I keep a close eye on the Nursing Council of New Zealand website for updates on nursing regulations, ethical guidelines, and any changes in scope of practice. I also ensure that I'm fully aware of the registration and renewal requirements to maintain my practice. Peer collaboration. I engage in regular discussions with colleagues and mentors in the healthcare field. This collaborative environment allows me to exchange knowledge and experiences and stay informed about any shifts in the nursing landscape. Professional journals and publications. I subscribe to respected nursing journals and publications, such as the New Zealand Nursing Review, which help me keep up with new research, trends, and clinical practices. Workplace and service training. In my current role, I take advantage of in-house training and updates from my employer, including mandatory courses that focus on New Zealand-specific health standards and protocols. By actively engaging in these activities, I ensure that I am well prepared to provide the highest standard of care and comply with the evolving healthcare regulations in New Zealand. 10. Why do you want to work as a registered nurse in New Zealand, and what do you know about our healthcare system? I am extremely interested in working as a registered nurse in New Zealand because of the country's renowned healthcare system, which values high-quality patient care, innovation, and continuous professional development. New Zealand has a well-structured and supportive healthcare environment, where I feel my skills and experience can make a real impact in the lives of patients. I admire the commitment to patient-centered care, as well as the emphasis on holistic health that supports both the physical and emotional needs of patients. I am also drawn to New Zealand's focus on nursing professionalism and ethical practice. The country's Nursing Council of New Zealand provides clear guidelines, and I appreciate how nurses are encouraged to stay up to date with new research and evidence-based practices. I understand that New Zealand's healthcare system combines public and private sectors, with the public system being publicly funded and providing essential services to residents. The emphasis on accessibility and equity in healthcare aligns with my values, and I'm excited about contributing to this by providing compassionate and high-quality care. Working in New Zealand would also offer me an opportunity to grow personally and professionally by learning from an international perspective, particularly as the country has a diverse cultural background, including Maori, Pacific, and Asian populations. I would love to be part of this inclusive healthcare system while contributing my knowledge and experience as an RN. Do you have any questions for us? Yes, thank you for asking. I do have a few questions. What is the typical nurse-to-patient ratio on the units you'd be working in? And how does your team ensure a manageable workload for nurses? Can you tell me more about the opportunities for professional development and continuing education here? How would you describe the culture within the nursing team and the wider healthcare facility? Are there any particular challenges your nursing staff have been facing recently? And how does the management support the team in overcoming those challenges? What are the next steps in the hiring process? And when can I expect to hear back from you? Thanks for watching. I hope this video has helped you feel more confident and prepared for your New Zealand registered nurse interview in 2025. Don't forget to like, subscribe, and share this video with others who might find it useful. If you have any questions, leave a comment below or reach out to us directly at Damal Consult Career Academy. Best of luck in your nursing career. You've got this.